unravelling the differences between angina versus heart attacks. So welcome back to my YouTube channel. Today we're going to delve into a topic that often causes confusion to many, the differences between angina and heart attacks. So don't forget to watch all the way through to the end, and please hit that subscribe button so you don't miss out on any of our important videos. So let's start with the basics then. What is angina? Well, angina is chest pain or discomfort that occurs when the heart doesn't receive enough oxygen-rich blood. Now, it's usually a symptom of an underlying heart condition such as CAD, chronic artery disease. And the most common cause of angina is when the arteries become narrowed or blocked, restricting the blood flow to the heart muscle. So how does one know they're having an angina attack? Angina is often described as a tight, squeezing or pressure-like sensation in the chest. It also radiates to the arms, shoulders, neck, jaw, or even the back. Angina pain typically occurs during physical activity or stress, and it's relieved with rest or medication like a GTN spray. And it usually lasts for a few minutes and subsides once a trigger is removed. So if that's angina, what's a heart attack then? Now, a heart attack is also known as an MI. MI stands for myocardial infarction, and this occurs when there's a sudden blockage in one or more of the arteries. And this blockage cuts off the blood supply to the portion of the heart muscle, leading to its damage or death. Now, it's a medical emergency that requires immediate attention. Now, the symptoms of heart attack are very similar to those of angina, but they are more severe and they persist for longer durations. So we have chest pain or discomfort, and that's often the primary symptoms, but it can also include shortness of breath, nausea, lightheadedness, sweating, like clammy, and a feeling of impending doom. But unlike angina, heart attack pain doesn't subside entirely with rest or medication. So it's clear that the symptoms of angina and heart attacks do overlap to some extent. So how can you decide if it's a heart attack or angina that person's having? Well, very simply, if someone is having chest pain, shortness of breath, you are going to call the emergency medical services, and you're going to reassure them, keep them calm, and ideally sit them on the floor in a W position with their knees bent. You're also going to see if they've got any medication they've been told to take when they experience these sort of pains in the past, because they might have that GTN spray. So it doesn't really matter if it is a heart attack or an angina attack, you're still going to treat them exactly the same. There's one way a medical professional can sort of sometimes tell the difference between an angina or a heart attack, and that's normally due to the severity and duration of pain or discomfort. Because a heart attack pain is typically more severe, lasting longer, more than 20 minutes, and is often accompanied by other distressing symptoms. There are also diagnostic tests that can confirm the presence of angina or heart attack that can be done by medical professionals at hospitals. So diagnosis usually involves a combination of a person's medical history, a physical examination, and various tests like an ECG, stress tests, or blood tests to measure the enzymes released during the heart muscle damage. But it is essential for everyone to have a basic understanding really of these conditions, and also know how to be able to treat these conditions. Because if you or someone experiences chest pain or any related symptoms, it is crucial that you seek immediate medical attention. It's always better to be safe than sorry. Now stay informed and stay healthy. Until next time, guys. Please don't forget to hit that subscribe button.